If there were a way of eating that could lower your blood pressure, reverse prediabetes, reduce inflammation in your blood vessels, and even help you avoid heart surgery, wouldn't you want to know what it is? And what if you discovered that this diet is keto, high in fat and low in carbohydrates, the exact opposite of what you've been told for decades? How would you react? This video will take you through the full journey, from common misunderstandings about cholesterol to the actual effects of keto on heart health, and why so many people over 50 have been able to stop using statins, diabetes medications, and avoid emergency room visits simply by changing the way they eat. This isn't theory. These are real outcomes, backed by clear biological mechanisms and documented clinical experience. Could the food you're eating every day be quietly pushing you closer to a heart attack without you even realizing it? And is keto truly a sustainable solution or just another passing trend? Watch until the end of the video to decide for yourself. One thing many people don't realize is that heart disease is not only preventable, it can be significantly improved through diet alone. Among the dietary approaches that have been thoroughly studied, keto, low-carb, and carnivore have shown the most measurable impact on cardiovascular biomarkers. This goes beyond theory. Thousands of people over the age of 50 have seen real-world results. What happens when you drastically cut carbs, eliminate sugar and refined grains, and instead eat natural fats, animal protein, and whole foods? Insulin drops, visceral fat disappears, blood pressure stabilizes, triglycerides go down, HDL goes up, and most importantly, markers of inflammation in the blood drop significantly. These are key factors in preventing atherosclerosis and reducing the risk of coronary artery blockage or stroke. Many people believe cholesterol is the main cause of heart disease, but in reality, long-term insulin resistance is the deeper underlying factor. When insulin remains elevated, the body is more likely to store visceral fat, blood vessels become chronically inflamed, endothelial function declines, and the risk of blood clots increases significantly. A traditional diet high in carbohydrates and sugar keeps insulin levels high, whereas the keto and carnivore diets bring insulin down to safe physiological levels. Additionally, a diet rich in high-quality animal-based foods provides essential micronutrients like vitamin K2, B12, iron, zinc, taurine, and creatine, all of which play critical roles in maintaining cardiovascular health and supporting the function of heart muscle cells. Clinical research has shown that when patients follow a strict ketogenic diet, they not only lose weight but also reduce their overall cardiovascular risk. A meta-analysis of randomized trials found that low-carb diets lower triglycerides more effectively than any other dietary approach. A study from Virta Health demonstrated that patients with type 2 diabetes who followed a ketogenic diet for 12 months showed improvements across all cardiovascular markers, with over 90% reducing or discontinuing their diabetes medications. As metabolic health improves, the risk of heart attack and stroke decreases accordingly. Many individuals who have undergone stent placement or bypass surgery have switched to a low-carb diet and found that their blood pressure, blood sugar, and fluid retention are better controlled. Some patients who once relied on high doses of insulin now manage their condition through diet alone without medication. Within the carnivore community, many report not only better control of heart disease, but also improvements in arthritis, insomnia, depression, and chronic digestive disorders. The common thread across keto, low-carb, and carnivore diets is the complete elimination of processed foods. No more industrial seed oils, no more white bread, no more soft drinks or fast food. When the body no longer has to process refined carbs and oxidized oils, systemic inflammation drops dramatically. This is something medications cannot achieve because drugs only adjust numbers temporarily, while dietary changes address the root cause. For older adults, the ability to recover after a heart attack or stroke depends heavily on baseline metabolic health. The right diet not only prevents arteries from becoming blocked again, but also supports cardiac muscle function, reduces fatigue, restores brain circulation, and improves overall quality of life. Importantly, it is never too late to start. Even if you've lived for years with high blood pressure or diabetes, changing the way you eat today can bring noticeable improvements within just a few weeks. Since the late 1970s, Americans have been advised to eat less fat in order to prevent heart disease. Low-fat labels flooded grocery store shelves. Animal butter was replaced with margarine. Eggs and red meat were treated as foods to avoid. Vegetable oils were promoted as heart-healthy alternatives. From that point on, the rates of obesity, diabetes, and cardiovascular disease have steadily increased with each passing decade. The question is, were we misled by a flawed assumption from the very beginning? Traditional dietary guidelines claimed that eating saturated fat would raise blood cholesterol and lead to atherosclerosis. But growing research shows that total cholesterol does not accurately reflect cardiovascular risk. LDL is only one piece of the larger picture, and not all LDL is harmful. It is the small, dense, oxidized LDL particles that are more likely to damage the blood vessel lining, while large, buoyant LDL particles carry much lower risk. However, standard blood tests do not distinguish between these types, and many patients are placed on statin therapy based solely on total LDL numbers. The healthcare system, driven partly by habit and partly by legal and administrative pressure, has clung to the low-fat model for decades. This has been reinforced by financial influence from both the pharmaceutical and processed food industries. While drug companies profit from statin and blood pressure prescriptions, food corporations benefit from selling low-fat products that are loaded with sugar, starches, and artificial flavorings. Patients are caught in the middle, told they are eating healthy while becoming increasingly dependent on medication. It is true that statins can reduce the rate of cardiovascular events in certain high-risk groups. However, prescribing them broadly to people with elevated cholesterol without also assessing insulin levels, blood sugar, inflammation markers, or dietary habits is a serious failure of modern medical practice. Many physicians receive little to no training in clinical nutrition. They rely on recommendations from professional societies that are themselves influenced by industry funding and commercial interests. This creates a cycle where patients are treated based on lab numbers rather than the full context of their metabolic health. Another issue is the lack of flexibility in updating medical knowledge. Despite a growing body of research demonstrating the benefits of diets high in healthy fats and low in carbohydrates for improving metabolic health, very few of these findings are incorporated into medical textbooks or official treatment guidelines. As a result, many newly trained doctors continue to advise patients to eat whole grains, avoid animal fats, choose vegetable oils, and consume fruit without restriction. Meanwhile, the number of people living with diabetes, high blood pressure, heart failure, and stroke continues to rise. Patients need to be empowered with the knowledge to ask the right questions. When a doctor tells you to avoid eggs but encourages whole grain bread, you have the right to ask why. When you are prescribed statins without anyone checking your insulin levels, CRP, or visceral fat, you have the right to request a more comprehensive evaluation. And when you find yourself increasingly dependent on medication without meaningful improvement in your health, you have every right to re-examine the nutritional foundation of your care. Both the heart and the brain require a continuous supply of oxygen-rich blood to function properly. When blood flow is blocked by atherosclerotic plaque or a blood clot, cells begin to die within minutes. If the blockage occurs in a coronary artery, it leads to a heart attack. If it occurs in a cerebral artery, it results in a stroke. Both events can happen without any clear warning signs. The danger lies in the fact that most underlying causes begin with vascular inflammation and long-term insulin resistance, two factors that can be significantly improved through proper dietary changes. One of the most common mistakes in treating heart disease and stroke is focusing on lab numbers while ignoring root causes. Patients are often told to eat less fat to lower cholesterol and are prescribed statins if LDL remains high. But few people ask why so many patients who have taken statins for over a decade still suffer heart attacks or strokes. The reason is that we are treating a number, not addressing the underlying biological mechanisms driving the disease. Insulin resistance is a serious foundational problem that is often overlooked.
When insulin remains chronically elevated due to a diet high in starch and sugar, the body stores visceral fat, triggers vascular inflammation, and damages the endothelial lining. Even if cholesterol levels are not high, the atherosclerotic process continues silently. Yet in clinical practice, few providers measure fasting insulin or assess HOMA-IR. Most doctors still rely on total cholesterol and LDL to assess cardiovascular risk, leading to medication being prescribed rather than reevaluating the patient's diet. Another common mistake is the blanket recommendation to eat more whole grains and sweet fruits in all situations. This may be appropriate for healthy individuals who are physically active and have good insulin sensitivity, but it is the wrong advice for those with prediabetes, middle-aged obesity, or fatty liver. Many people believe they are eating healthy when they start their day with whole grains, eat fruit at every lunch, and replace animal fat with vegetable oil. Yet their insulin remains high, visceral fat continues to increase, and their blood vessels grow weaker.
The overuse of medication for prevention is another concern. There are patients over 60 who are prescribed lifelong statin therapy simply because of slightly elevated cholesterol without a full risk assessment. For someone with high HDL, low triglycerides, no smoking history, no underlying conditions, and regular physical activity, lowering LDL from 130 to 90 with medication offers little practical benefit. Meanwhile, side effects such as muscle pain, fatigue, memory loss, or liver damage can have lasting effects on quality of life. This is even more concerning when patients are not fully informed about the actual benefits and risks of long-term medication use. Another serious mistake is overlooking the role of vascular inflammation. The high-sensitivity CRP test, which reflects systemic inflammation, is a better predictor of cardiovascular risk than LDL, yet it is rarely ordered in practice. This type of inflammation is driven by poor nutrition, oxidized vegetable oils, refined sugar, and a sedentary lifestyle. These factors cannot be controlled with medication alone. They require changes in diet and physical activity. The final mistake is underestimating the body's natural ability to heal. With proper nutrition, adequate sleep, stress reduction, and regular movement, many people have reduced or discontinued medications, recovered after a stroke, or avoided heart surgery altogether. But this only happens when they move beyond outdated advice and begin to understand how their bodies truly function. Many heart attacks and strokes do not begin with sudden intense pain or fainting spells as commonly believed. In reality, many cases occur after the person has experienced vague, easy-to-overlook symptoms for weeks or even months. Recognizing these early warning signs can be the difference between life and death, between recovery and permanent disability. One of the most common early symptoms, often dismissed, is persistent fatigue without a clear cause. Many people over 50 begin to feel sluggish, weak, have trouble concentrating, or become short of breath during simple activities like walking short distances. These signs are often attributed to aging, but in many cases they indicate that the heart is no longer pumping efficiently due to reduced blood flow to the heart muscle. Another sign is difficulty sleeping or waking up frequently at night with a racing heartbeat or mild chest discomfort. This may result from fluctuations in blood pressure or nighttime arrhythmias. Atypical chest pain is another important indicator. Instead of sharp, intense pain, many people experience mild pressure, discomfort radiating to the left shoulder, jaw, or back. The discomfort may last only a few minutes and occur during exertion or after a high-carbohydrate meal. In women, symptoms tend to be less obvious and may include nausea, dizziness, extreme fatigue, or a sudden sense of anxiety. For strokes, early warning signs can include mild numbness on one side of the face or limbs, slurred speech, brief blurred vision, or loss of balance when standing. These symptoms may resolve on their own within minutes, a condition known as a transient ischemic attack. However, this is a serious warning sign, as many people experience a full stroke just days or weeks later. The problem is that most older adults don't associate these subtle symptoms with the heart or brain. They wait until the condition becomes severe before seeking medical help, often when it's already too late.
Understanding and recognizing early warning signs not only allows for timely medical intervention, but also presents a critical opportunity to make lifestyle changes before irreversible damage occurs. There is no single diet that works for everyone, but there are common principles that help determine which eating patterns best support heart health. The four most popular approaches today are keto, carnivore, Mediterranean, and plant-based. Each model has its strengths, limitations, and varying degrees of suitability depending on individual health status and goals. The keto diet focuses on significantly reducing carbohydrate intake, increasing healthy fats, and maintaining moderate protein levels. When carbs are lowered, the body shifts to burning fat for fuel, which leads to reduced insulin levels, decreased inflammation, improved triglycerides, and higher HDL. Keto is particularly effective for people with prediabetes, abdominal obesity, fatty liver, and high blood pressure. However, those following a keto diet must pay attention to electrolytes, get adequate sleep, and choose natural fats from whole foods rather than relying on highly processed keto products. The carnivore diet takes keto a step further by eliminating all plant foods and relying solely on animal-based foods. Its strengths lie in simplicity, strong anti-inflammatory effects, and rapid improvements in individuals with autoimmune conditions, arthritis, digestive disorders, or severe insulin resistance. Many people over 50 have experienced measurable cardiovascular improvements after following a properly structured carnivore diet for a few months. However, this approach is not easy for everyone to maintain long-term and requires close monitoring of biochemical markers during implementation. The Mediterranean diet is considered a moderate approach, emphasizing healthy fats from olive oil, fatty fish, nuts, vegetables, and a low to moderate carbohydrates. This model is supported by numerous studies for its role in reducing cardiovascular risk, especially when combined with regular physical activity and sufficient sleep. However, many people apply it incorrectly by consuming too much whole-grain bread, sweet fruits, and industrial vegetable oils, which undermines its intended benefits. The plant-based diet is entirely plant-derived, high in fiber, and low in saturated fat. When done correctly, it can help with short-term weight and blood pressure control. However, a major limitation is the lack of several key nutrients essential for heart health, including vitamin B12, heme iron, zinc, taurine, and bioavailable omega-3 fats. Many individuals over 50 struggle with nutrient absorption and maintaining muscle mass when following a long-term vegan diet. The most important factor is not which model you choose, but whether you can sustain it consistently and base your diet on whole, unprocessed foods rather than industrial products marketed as healthy.
I once met a man in his early 60s with a history of type 2 diabetes, high blood pressure, and elevated cholesterol. He had been taking medication for nearly 15 years, did light exercise every morning, and followed his doctor's advice to eat a low-fat diet rich in whole grains and fruit. Still, his HbA1c remained high, his blood pressure was unstable, and his doctor had recently started discussing the possibility of a stent. After learning about the low-carb diet, he decided to give it a serious try. For 3 months, he eliminated all sugar, rice, bread, and sweet fruits, and switched to eating meat, fish, eggs, leafy greens, and natural fats. The results were striking. His blood sugar dropped, his diabetes medication was cut in half, his blood pressure stabilized, and he lost more than 7 kilograms without feeling fatigued. 3 months later, his doctor confirmed that no coronary intervention was needed as long as he continued with the diet. Another case involved a 58-year-old woman who had suffered a minor stroke 2 years earlier. After the event, she continued on a low-fat diet and was prescribed statins, blood pressure medication, and blood thinners. While everything appeared stable, she constantly felt fatigued, had muscle pain, and struggled with poor sleep. When she tried the keto diet, removing grains, sugar, and vegetable oils, within 2 months she began sleeping better, experienced less pain, and noticed a marked improvement in her mood. Most importantly, she felt like she was finally in control of her body instead of being dependent on a prescription. Stories like these are not uncommon. When patients understand the root mechanisms of their condition and take initiative to change the way they eat, they can often avoid surgery, reduce medication, and regain a quality of life they thought was gone for good. The first step is to eliminate foods that disrupt metabolic function. Avoid all forms of refined sugar, including honey, syrups, and fruit juices. Completely remove bread, pasta, packaged cereals, and white rice. Eliminate industrial vegetable oils such as soybean oil, sunflower oil, canola oil, and margarine. These foods raise insulin levels, promote inflammation, and gradually weaken blood vessels over time. Instead, prioritize whole, nutrient-dense foods: beef, wild-caught fish, eggs, liver, pasture-raised chicken, leafy greens, butter, extra virgin olive oil, avocado, full-fat cheese, and plain water. There is no need to overeat. Simply eat enough to feel full, and do not force prolonged fasting if your body is not yet adapted. If tolerated, consider eating 2 meals per day and skipping breakfast if you are not hungry. This can help lower insulin frequency and support more efficient fat burning. For health monitoring, it is important to regularly test key metabolic and inflammatory markers, such as fasting glucose, fasting insulin, HbA1c, triglycerides, HDL, LDL, ApoB, and high-sensitivity CRP. These values provide a more accurate picture of metabolic health than total cholesterol alone. If possible, consider a coronary artery calcium scan to assess the extent of arterial calcification. This is one of the most accurate predictors of heart attack risk available today.
If you're currently taking medications for diabetes, high blood pressure, or cholesterol, it is essential to work with a healthcare provider who understands metabolic nutrition. As your diet improves, your need for medication may decrease rapidly within a few weeks. Reducing medication without proper supervision can lead to hypoglycemia, low blood pressure, or arrhythmias. Careful monitoring and step-by-step adjustments are necessary. Also pay attention to sleep, stress levels, and daily physical activity. Intense exercise is not required. Walking for 30 minutes each day, getting at least 7 hours of sleep, and minimizing chronic stress are enough. The body needs stability to recover from years of chronic inflammation and metabolic dysfunction. When done correctly, within just a few weeks, you may notice improved mental clarity, reduced fatigue, better digestion, and significant improvements in lab results. If you're over the age of 50 and have a history of diabetes, high blood pressure, elevated cholesterol, or past episodes of chest pain, what you've just watched is more than information. It may be your opportunity to completely change the course of your health. We can no longer live under the old assumption that medication will solve everything, that eating low-fat and high-grain diets is always safe, or that heart attacks are inevitable. You have the right to ask questions, to reevaluate past advice, and to take full responsibility for your body. Diet is not a secondary option. It is the foundation. What you eat every day is either healing your blood vessels or silently damaging them. The good news is that you can start at any time. You don't need special equipment, a new treatment plan, or another prescription. All it takes is one clear decision to change the way you eat starting today. Thousands of people have avoided cardiovascular complications, reduced their medications, and regained their health simply by asking the right questions and making changes at the root level. The real question now is, will you wait until you're on the operating table, or will you begin changing your health at the dinner table today? If this content has helped you better understand the real causes of heart disease and the practical steps you can take to protect your health after age 50, consider following this channel so you don't miss future in-depth topics on nutrition, metabolism, and recovery after chronic illness. This is a place for reliable, easy-to-understand medical information that you can apply in everyday life. Health is not something you can borrow. Take the initiative to learn, understand, and act starting today.